Good day, ladies and gentlemen. My name is Fulu. I'm a medical physicist. I'm going to discuss about the radiotherapy technology. That is, I'll be discussing at length the kind of equipment that we expect to find in an ideal radiotherapy clinic or department. My purpose is that at the end of this discussion, when we're talking about the radiotherapy department, an individual has to understand the kind of equipment that they expect to find. We've got the major equipment, associated equipment, and ancillary equipment that we can find in the radiotherapy department. I'll start with the major equipment. Commonly, everybody knows this, the issue of the Linac and the Cobalt-60. Those are the main machines that we expect to find, or for us to say we have a radiotherapy department. We expect to be having a Linac, we expect to be having either a Cobalt, and we have the brachytherapy or orthovoltage X-ray units. Often there's usually debates in the department as to whether they should have a linear accelerator or a Cobalt-60. And they can have additional to this, to either of these two, they can have a brachytherapy unit. This can also either be the Cobalt-61 or the Iridium-192. There are reasons which usually determine what kind of unit each department can opt to have. Also, other than the major equipment, we also have the associated equipment. This we're talking about the conventional simulator, that is for people still having the 2D kind of setup, and we also have a CT simulator where now we are having the departments that have like 3D kind of planning. They have in the likes of IMRT, VMS technology in their setups. And we also have the C-arm fluoroscopy X-ray unit, often like in the department that I've worked in. This is found usually in the brachytherapy unit. We also have the ultrasound imaging system that is usually for image-guided techniques. Additional to the associated equipment, in the radiotherapy department, it is also normal to find, or should I say, it is expected to find the planning station. And here we're talking of the TPS, the treatment planning systems, which I'll later in the discussion show images of, or rather explain in detail. We also have the information management softwares, which we have also images, or rather the examples of such systems, which I'll explain during the presentation. We also have the ancillary, or rather, should I say, additional equipment in addition to the rest that I've just said. This we're talking of items such as the patient immobilizing equipment, the mold room, which is currently we're talking of the machine room where actually we do the kind of the cutouts. And we also have the dosimetry and quality control equipment, that is usually the devices under the utilization of the medical physicist. We also have the radiation safety equipment. Now, giving an idea, or rather images of this major equipment that I was talking about. We also have the linear accelerator here. I've used the Versa HD as an example, not that I am marketing one. It is the one that we're having in the country under the GPH Life Healthcare Department. And behind this fancy equipment that we are seeing, the one in blue, you have the actual machine room. That is the ugly side, which most people usually do not come to know of. They just end up here knowing that it's one fancy equipment, but there is the driving force behind all this fancy equipment to the generation of the actual megavoltage X-rays that we use for treatment. When you look at this machine, the linear accelerator, which is being housed in the country at Life Healthcare in GPH, you find that this is the Versa HD, is one of the trending kind of the top of the range modalities that they have from Electa. After this, there is the Harmony. Yes. When you look at this image, this is where actually your radiation will be coming from. And on the side there, on the right side, we have the cone beam CT, and that is the panel, the detector that is used for imaging. And this will have this, we'll say, we've got the X-ray set, and vertically opposite to the head of the Linac, there is a panel here which is also a detector that is for mega voltage imaging. So under the linear accelerator, that is what we have. And an option to the linear, other facilities, they opt for the Cobalt 60 teletherapy unit. This is be fed by different reasons to say, why did you opt for a Cobalt versus a Linac? But the current topic is what technology, what kind of equipment is either you've got the linear accelerator or you have the Cobalt 60. Additional to the two that I've just listed, you can also have, and under the ideal, you'd have either of the two, the Cobalt or the linear accelerator, and you will have the brachytherapy afterloader. Under the brachytherapy afterloader, here I've put in the Flexitron, which is the new machine which was just acquired by the GPH. And on this right side, we've got the console, that is the actually the unit that is used to drive this brachytherapy machine. Other than the brachytherapy, we also have the ortho voltage. This is where we are using like from 50 to about 500 to 100 to 500 kilovoltage for treating of the superficial lesions. And the topic, somebody can ask, are we still having this technology in this era? Yes, we're having this technology. I'll discuss later to say, is it still important? Yes, others, they argue that you cannot do without this. Others argue to say, with the current mode of technology, you can live without this. That is a topic for another day, but these are the kind of technologies that we do have in the radiotherapy department. We also have the treatment planning hardware. For example, this is where actually we would say the heart of the radiotherapy center. After you have got all these CTs, the patient is here. Now, how are we going to treat this patient? This lesion that we have, how are we going to hit it with our radiation? We have to delineate to say this is our actual tumor that we are looking into, and these are the organs at risk that we intend to spare. And then how do we achieve that? We have to be having a treatment planning system. We've got different ones. You can have the Monarch, or you can have the Ray Station, depending on your appetite or your need and your budget, which we shall discuss later. So we do have the treatment planning station. And then we have the imaging equipment. Under the imaging equipment, I've got phases of the best practice radiotherapy processes. That is, under the ideal, you expect a department to be having this, but due to certain limitations and reasons, we have only those which have like the basic, but under the ideal, it would be nice to have all this. And then this imaging equipment, I've fragmented them to their use. For example, we have the CT, MRI, PET, and the SPECT, which are used at the diagnosis and the staging phase. And then we have the treatment simulation where we are using the CT, and we have the treatment planning, which I just discussed. You can have CT, MRI, PET, and SPECT. And usually those who use a combination of all this, they usually do this and they fuse all these images in their treatment planning. But it is okay for a unit to just have CT modality for their treatment planning. And then we have treatment and localization. This is now when you are in the treatment machine. Like I explained to you when I was showing you the image of the linear accelerator, where we have the Versa HD, which has got a combination of the cone beam CT and the MV for imaging, that is for image guided radiotherapy. And another phase is the treatment delivery. We also have lasers which we are using. We have the fluoro, we have the actual CT, and then for follow-up, we can have the CT, MR, PET, and SPECT being used to assess the response rate of the patient to the ultimate treatment that we wanted to give. Now, after I've just shared with you all the kind of equipment that we expect to have in the radiotherapy, the question is, what equipment do I buy in my facility, or should we expect in a facility? There are factors which will influence what equipment you're going to buy. For example, the National cancer control plan and the strategies. Here we're going to look at the demographics to say, what are we actually having in our country? What is the cancer phase in Botswana? To say, now that we know that we have this kind of cancers, it means we can buy this kind of equipment, which will help us to address the kind of cancers that we're having. And the other factor that determine what equipment you buy is the availability of infrastructure. The infrastructure, can it contain that which you desire to house? And the other factor is the availability of specialized health workforce. For example, if you desire to go SRS, like stereotactic radiosurgery, do you have the health care workers who can do such techniques? If you're going to choose, we want a harmony that has got features which allow us to do VMAT, IMRT. Do I have the staff in the personnel that can deliver on that? And the last factor that I would like to discuss is the availability of the available budget. Do we have enough funds to buy that which we desire to have? Usually, most people, they desire to have the best, but do we have the funds to buy the best? Usually, it's the funds that ultimately determine what kind of equipment you're going to have. So in a nutshell, that is all about the equipment in the radiotherapy department and what actually will feed into say, what kind of equipment can I buy? Thank you, ladies and gentlemen. If there are questions, we shall be ready to take them.